Hello everyone. Since doing my video on circumcision, a small number of people have continued to try and justify the procedure to me. A lot of them don't seem to realize the risks associated with it. This video is addressed to anyone who has ever used the phrase, "What's the harm?" when referring to the practice of circumcision. I feel I should warn you that, while what I am going to say is extremely important, it may be disturbing to some people. I was surprised when my investigations into circumcision complication rates gave me very few results for the Western world. Mortality rate in particular is extremely difficult to assess, since many deaths are due to the infections associated with the wound. The coroner will usually attribute the death to said infection without mentioning the circumcision that led to it at all. Fortunately, I managed to get my hands on an excellent paper published in the British Journal of Surgery in 1993. The paper is called Complications of Circumcision, which I will cite in the description bar below. This review goes through quite a bit of data, and I won't be able to adequately cover it all here, so keep that in mind. I'll be going through a couple of cases as well as more generalized issues with the procedure. I'm also operating under the assumption that everyone is aware that circumcision doesn't prevent HIV or cancer. It also doesn't appear to really reduce urinary tract infections or sexually transmitted infections as long as proper hygiene and safe sex practices are maintained. The first circumcision practice I'll go into is diathermy. Basically, instead of using a normal blade, the surgeon uses a cauterized blade in order to prevent bleeding by essentially burning the wound's edges shut. The articles from the Annals of the Royal College of Surgeons of England, one from 2000 and one from 2009, seem to be big fans of this technique. Both papers have concluded that diathermy can, quote, be a safe and simple operation. As a quick aside, I hope everyone is a little more cautious when flinging around information found in reputable peer-reviewed documents. Not all peer-reviewed literature is all it's cracked up to be. Anyway, let's see how safe diathermy really is, shall we? The paper I'm citing mentions there may be some undocumented cases of minor burns, but there are definitely reports of much more severe injuries such as penile skin necrosis. The most severe cases result in total ablation of the penis. At least 4 cases such as this have been described. If you know anything about the story of David Reimer, this should sound familiar. I will post a link to his story below. When diathermy isn't used and bleeding can get out of hand, it isn't uncommon to use an adrenaline solution to stop the bleeding. In 4 cases, a sponge soaked in an adrenaline solution was applied to the circumcision wound for a few hours. All of the children developed an accelerated heart rate and eventual heart failure. Luckily, these children were able to be treated successfully and they recovered. Ironically, infections occur in up to 10% of patients after circumcision. I find this particularly stupid since one of the major reasons used to justify circumcision is to prevent infection. Most cases are usually mild and manifest themselves as local inflammation. On occasion, however, sepsis can develop, which has the potential of causing death. The paper cites at least 1 death in the case of a 6-week-old child, which was directly related to the circumcision. 5 other children developed neonatal meningitis from infection of the circumcision site. 3 of those children recovered. 1 developed cerebral palsy as a complication of meningitis and the other died. Infection isn't the only concern. Gangrene of the penis may also be reported. There have been 2 confirmed cases. Both of the patients survived, but one of them required extensive surgery. Another serious complication seems to be acute urinary retention, which is associated with devices used in circumcision. There was a case where the Plastabell device was employed, which resulted in the child's bladder rupturing. Not only can the urethra be compressed, which prevents the child from voiding their bladder, but the blood flow may also be stopped, which can, in severe cases, result in necrosis of the penis and the glans. A search through news sources revealed that this very issue killed a 1-week-old baby in Ottawa in 2007. The child went into septic shock and his bladder was described as being 7 to 8 times the normal size. The parents requested the name be withheld, but the news story can be read below. Then there's the issue of bleeding. What looks like a small amount of blood to either you or me can be huge for an infant. Diapers also tend to absorb any blood, making it really difficult to assess how much bleeding is actually occurring. There was at least 1 case in Reading in 2007 where a 9-week-old boy bled to death as a result of being circumcised. Again, the news article can be read below. After I go through the next case, I dare anyone to tell me that this isn't a horrifyingly painful procedure. A child developed recurrent pneumothorax after being circumcised. A pneumothorax is a collapsed lung. Some of you may be wondering how a lung can collapse because of circumcision. This infant was in so much distress that, when combined with a rapid heartbeat, cyanosis, and moderate bleeding, he cried so hard that one of his lungs actually ruptured. He was hospitalized for 19 days and fortunately successfully recovered. Another news article I found pointed to a similar case where an infant's distress caused complications, and in this case death. A 1-week-old baby in London in 2007 suffered a fatal heart attack during his circumcision. Now, if this hasn't struck a nerve yet, I'd imagine some of you may be thinking, but the rate of complications is so low, they're almost negligible. Well, you know what? It doesn't matter. When faced with medical decisions, the risks of the procedure have to be weighed against the risks of not having the procedure done. In the case of male circumcision, there are negligible benefits at best. Even urinary correction is over-recommended, and most children do fine without it. This leaves us with simple aesthetic reasons. If you're willing to risk your son for the sake of having his penis look the way that you think it should, then I have to seriously question your judgment as a parent.